Something a little bit softer, moisturizers. Moisturizers are products that help your skin either retain water or gain water. They could be a cream, they could be lotion, ointment, serum. You're all familiar with different versions of them. We've talked about skin a lot so far. Let's look at skin schematic view. The first slide on your left side is a cross section of skin. The top layer is the epidermis, which is when you touch your face, you're touching the epidermis, you're touching the most outer layer of your skin. Underneath it, there is like a blanket of protein. That blanket of proteins is called dermis, which is mainly consists of collagen and elastin. I always tell my patients, think of collagen and elastin as a scaffold that your skin is draped over it. As we age, this dermis gets thinner. That's why you start noticing crepiness in your skin. When you pull your skin, it doesn't quite snap back the same way it did in your 20s, right? It's because this scaffold here starts to thin as we age. Something interesting here is the fastest rate of aging in women is between ages of 43 to 49. Because of hormonal changes, you get 30% reduction in your collagen level. And this is why people come to our office and say, you know, I was fine until one day I woke up, Dr. Hakimi, and my skin was just not the same. This is the reason. And underneath the dermis, you have fatty layer, subcutaneous fat. Now, when we blow up epidermis, you know this name now, right? Stratum corneum. The most outer layer of the skin is the dead skin from the past that we want to remove, whether it's biochemical peels or products at home. And then you remember this curvilinear stem cell line. This is where retin-A and growth factors are going to work on to help make new skin cells. And these new skin cells, we want to get them up to the surface as fast as we can. Now, when you look at the epidermis itself, it has a brick and mortar kind of structure, right? Think of these as your skin cells, and the space in between them is filled with a combination of water and oil. There's a specific ratio. That's why some people have a drier skin just genetically. It's because of that ratio water to oil is different in these patients. And that oil is not like mineral oil. It's a fancy oil that's composed of cholesterol, ceramide, and fatty acids. You're going to hear more about them. But think of it. Nowadays, we wash our hands how many times a day? And you wonder why your hands are dry. It's because that oily layer on top that usually protects your skin from losing water is removed every time you wash your hands with soap. And you lose that protective layer, therefore it's easier for water in your skin to evaporate. When we talk about moisturizers, moisturizers are going to help here. Some of them are going to provide a layer of fat so water doesn't get out. Some of them are going to sit there and absorb water from the air and make your skin more moist. Some of them do none of the above. They enhance your own fatty layer so it protects your skin more. And those are these three types. Humectants are moisturizers that absorb water from the air and from your own body, and it brings it up to your skin. Occlusive agents, like ointments that you put on your skin, they basically close that pore or that top layer to keep the water inside. And this barrier enhancing agents, this is probably the newest generation of moisturizing agents. They enhance your own body's mechanism. they provide the ingredients. You remember I told you cholesterol, fatty acids, and ceramides. This group provides the basic elements so your body actually makes that fatty layer. Now, which ones fall into this category of water absorbing moisturizers? Hyaluronic acid. I'm sure everyone here has heard of it. There was a very famous commercial a few months ago that would go hyaluronic acid, right? It's a component of your skin. You already have it. It's made of sugar molecules, believe it or not, that are holding each other's hands and has these hydroxy groups at the end. If you remember from the slides, a few slides back, these hydroxy groups are water loving. They absorb water. So when you put hyaluronic acid on your skin, it absorbs water from the air and from your own body and brings it up to your skin. That's why your skin feels so good and it looks good, because we're putting a sponge to absorb water from your body and from the air. And there are some salts, hygroscopic salts, such as sodium lactate and sodium PCA. Without going into detail, if you see these in your skincare line, they do the same thing. These salts, glycerin, sorbitol, these are all water-loving elements that make your skin look and feel softer by absorbing water from the environment. Occlusive agents. This is the second group of moisturizers. Some of the examples: mineral oil, olive oil, petrolatum, and lanolin. These are basically occlusive agents that when you put on your skin, they cover up the top layer, as it's well demonstrated in this picture, so water can't escape. Now, for some of you with acne-prone skin, this may not be the best choice because it might make it worse, make your acne worse. So occlusive agents are not the best if you're someone with acne-prone skin. And the fancy one, barrier enhancing agents. These are three types: cholesterol, fatty acids, and ceramide. When you use moisturizing agents or moisturizers that include ceramide or cholesterol, what you're doing, you're providing the basic ingredients of this outer layer for your skin. So your skin will make the layer itself without covering it up, without causing occlusion of your pores. You're basically providing your own basic elements for your body to make that layer. Now, something that's not in this slide, but you might see it in your skincare line, is niacin. Niacin, niacinamide, these are vitamin B3 derivatives. They are important in the pathway in your skin that makes ceramide and cholesterol. So if you see niacin in your skincare line, it falls into the same category of barrier enhancing agent because it's involved in a pathway that helps your body make these three components. 1 second. So at this point, hopefully some of these now, when you look at hyaluronic acid, ceramide, you have an idea of what they do and what they mean. I use this slide to transition to Julie. She's in charge of, as I said, all the background work on producing and making, manufacturing our skincare line.